Hello, my name is Dr. Menon, and I am a colon and rectal surgeon for the Swedish Colon and Rectal Clinic. Today I will discuss the topic of constipation. Constipation may mean hard, dry bowel movements, difficulty eliminating bowel movements, and/or infrequent bowel movements that may begin with cramping or bloating. Many factors can contribute to constipation. Painful conditions of the anus can make it difficult to have regular bowel movements, which can result in large, hard, and uncomfortable bowel movements. Lack of liquid or fiber in the diet can also be partly responsible. Some medications may cause constipation. Poor habits, such as waiting too long to respond to the urge to move one's bowels, may also play a role. In other cases, poor muscle function of the intestine, resulting in slow movement of intestinal contents, may cause constipation. Abnormal function of the anal muscles may contribute to these conditions. Anatomic changes in the intestine, such as tumors, cancers, and other problems, can account for a change in the bowel habits. In many cases, no definite cause can be found. While most people have bowel movements somewhere between 3 times daily and every 3 days, some may go a week or two between bowel movements without harmful effects. However, if pain, cramping, or other discomfort develops, evaluation is suggested. Since constipation may have several causes, it is important to identify the reasons for the constipation in order to correct the problem as simply and specifically as possible. Several tests of intestinal and anal function are available to help determine the cause or causes in each individual case. Examination of the anorectal area is usually the first step. Examination of the intestine, either with a flexible lighted instrument or with a barium X-ray study, may also be important. A marker study, during which small markers given by mouth are followed for several days with repeated X-rays, can give clues to disorders of muscle function of the intestine itself. Testing of the function of the anus and rectum during the act of elimination can be helpful in determining failure of the anorectal muscles or internal issues of the rectum, such as rectocele, a pocket forming just above the anal muscle, or rectal prolapse, which is a portion of the rectal wall sliding down to or beyond the anus. Such tests may include videodefecography, an X-ray study of the function of the anorectal area, or anorectal manometry, which tests nerves and muscles of the anorectum. Prolonged daily use of stimulant laxatives that usually last over the course of several years may be damaging to the muscles of the intestine itself. Some types of laxatives are generally safe and not habit-forming. Short-term use, as directed, should not cause any significant problem. While many people find considerable relief from constipation after a month, the process of adding more fiber to the diet may take up to 6 months or more to work for other people. There is usually no way to predict in advance how quickly a particular individual will respond to such a program. Fiber supplements can be taken on a daily basis with no ill effects at all. In fact, the typical American diet would be made substantially healthier with the addition of more dietary fiber. Ultimately, the goal should be consumption of adequate fiber in your daily diet to prevent constipation. Fiber supplements are an easy and effective way to do this. This podcast is intended to be a general overview of constipation and how to treat it. Thank you for listening to the Plugged Into Your Health Cancer Podcast Program. For more information, please visit the Cancer Education Center for educational materials and resources.